Today we're talking about tetanus, a serious but preventable disease that still poses a threat in our everyday lives. Many people don't realize how easily tetanus can strike, or how quickly it can become life-threatening if left untreated. Despite advances in medicine, tetanus remains a concern, especially in areas where vaccination rates are low, or where people are exposed to environments that harbor the bacteria. Tetanus is caused by a powerful toxin released by bacteria that attack the nervous system. This toxin leads to severe, painful muscle contractions, most often starting in the jaw and neck, giving rise to the term lockjaw. As the disease progresses, these spasms can spread throughout the body, making it difficult to breathe or even swallow, and can be fatal without prompt medical care. The bacteria responsible for tetanus, called Clostridium tetani, are found almost everywhere in our environment, especially in soil, dust, and animal manure. These bacteria can survive for years in harsh conditions, making them a constant, invisible threat in places we might not expect. Any break in the skin, even a tiny scratch, a scraped knee, or an insect bite can provide an entry point for these bacteria. It doesn't take a deep wound or a dramatic injury. Just a small opening is enough for infection to begin. Unlike many contagious diseases, tetanus isn't spread from person to person. Instead, it comes directly from the environment around us. This means anyone, anywhere, can be at risk if they come into contact with contaminated surfaces or objects. That's why proper wound care and staying up to date with your tetanus vaccinations are absolutely essential. Cleaning even minor wounds right away and making sure you're protected with a vaccine can make all the difference in preventing this dangerous disease. Even the smallest injuries can be risky if the bacteria are present, so it's important to take every cut or scrape seriously. Don't ignore minor wounds. Treat them promptly and watch for signs of infection. In this chapter, we'll explore how tetanus infects the body, what symptoms to look out for, and, most importantly, how you can protect yourself and your loved ones from this silent but dangerous threat. Let's get started. Tetanus begins with a microscopic enemy, Clostridium tetani, a resilient bacterium that can survive for years in the harshest environments by forming tough, protective spores. These spores are incredibly hardy, allowing the bacteria to withstand heat, drying, and even many common disinfectants. These spores are found almost everywhere, lurking in soil, drifting in dust, and present in animal waste. Whether you're working in a garden, walking through a field, or simply exposed to dust, it's nearly impossible to avoid contact with them. They can cling to shoes, tools, and even the smallest specks of dirt. The real danger arises when these spores find a way into the body, usually through a break in the skin. Deep puncture wounds, like those from stepping on a nail or getting cut by a sharp object, are especially risky because they create low-oxygen environments where the bacteria thrive. Even minor injuries, if not properly cleaned, can provide an entry point. Once inside, the spores sense the conditions are right and spring to life, transforming back into active bacteria. They begin to multiply and release a potent neurotoxin called tetanospasmin, which is among the most powerful toxins known to science. This toxin travels along the nerves, blocking the chemical signals that tell muscles to relax. As a result, muscles contract uncontrollably, leading to the hallmark symptoms of tetanus. That's why even a tiny puncture from a thorn, a splinter, or an animal bite can be dangerous if contaminated. The wound may seem insignificant, but it can be the perfect gateway for infection. It's a common myth that tetanus is caused by rust, but the real risk comes from contaminated objects. Anything that's been in contact with soil or dirt can harbor the spores. The result can be severe, intense, painful muscle spasms and stiffness, often starting in the jaw and neck, but spreading throughout the body. These symptoms can appear days or even weeks after the initial injury, making the connection to the wound easy to miss. Any break in the skin, no matter how small, is a potential gateway for tetanus. That's why it's so important to clean all wounds thoroughly and seek medical advice if you're unsure. Recognizing the risk and understanding how tetanus spreads is the first step toward prevention. Vaccination, proper wound care, and awareness can protect you and your loved ones from this dangerous disease. Tetanus symptoms usually begin with jaw stiffness, lockjaw. Neck stiffness follows, then muscle spasms spread to the back, abdomen, and limbs. Even minor stimuli, light, sound, touch, can trigger painful spasms. Severe cases cause the body to arch backward, sometimes fracturing bones. Other signs include fever, sweating, rapid heartbeat, and a fixed, grimacing smile. Swallowing becomes difficult, increasing the risk of choking or pneumonia. If you notice these symptoms after an injury, seek emergency care immediately. Anyone can get tetanus, but risk is highest for the unvaccinated or those overdue for a booster. Adults often forget boosters, leaving them unprotected. Newborns and mothers in areas with poor vaccination and unhygienic birthing practices are at high risk. Older adults may lose immunity over time and are more prone to injuries. People with frequent skin injuries, like those in agriculture or construction, or who inject drugs are also vulnerable. Chronic wounds, like diabetic ulcers, are another risk. The common thread: exposure to bacteria and lack of immunity. Tetanus is a medical emergency because muscle spasms can stop breathing in minutes. Spasms can break bones, tear muscles, and make swallowing impossible, leading to pneumonia. The toxin disrupts heart rate, blood pressure, and body temperature, risking cardiac arrest. Even with treatment, recovery is long and difficult, and some survivors have lasting problems. Intensive care is often required for weeks. The mortality rate remains high, up to 20% even with modern medicine. Prevention is far easier than treatment. That's why vaccination is so critical. Vaccination is the most effective way to protect yourself and your loved ones from tetanus, a potentially life-threatening disease caused by bacteria found in soil, dust, and manure. Tetanus can enter the body through even the smallest cut or puncture wound, making prevention crucial for everyone, regardless of age. Children are especially vulnerable, so they receive a series of DTaP shots starting in infancy, with booster doses given throughout childhood to ensure lasting immunity. These routine vaccinations are a key part of keeping kids safe and healthy as they grow. For adults, staying protected means getting a tetanus booster shot every 10 years. This simple step helps maintain your immunity, especially as the risk of exposure can happen at any time, whether at home, work, or outdoors. If you suffer a deep, dirty, or puncture wound and it's been more than 5 years since your last tetanus shot, it's important to get a booster as soon as possible. Prompt action can make a big difference in preventing infection. Practicing good wound care is also vital. Always clean cuts, scrapes, or punctures thoroughly with soap and water, and apply an antibiotic ointment to help prevent bacteria from entering the wound. Cover the wound with a clean bandage to keep it protected from dirt and germs. Change the bandage daily, or whenever it becomes wet or dirty, to promote healing and reduce the risk of infection. Watch closely for signs of infection, such as redness, swelling, warmth, pus, or increasing pain. If you notice any of these symptoms, seek medical attention right away. For deep, dirty, or animal bite wounds, it's especially important to see a doctor promptly, as these injuries carry a higher risk of tetanus and other serious infections. By combining regular vaccination with proper wound care, you create a strong defense against tetanus and help protect your community as well. Don't wait for symptoms to appear. Prevention is simple, safe, and highly effective. Keeping your vaccination record up to date is a small step that makes a big difference. Stay informed, stay protected, and encourage your friends and family to do the same. Together, we can prevent tetanus and keep everyone safer and healthier. Treating tetanus requires intensive hospital care. Doctors give tetanus immune globulin to neutralize the toxin and antibiotics to kill the bacteria. The wound is cleaned thoroughly, sometimes surgically. Muscle spasms are managed with sedatives and muscle relaxants. Severe cases may need a ventilator to help with breathing. Recovery can take weeks or months, often with physical therapy. Even with the best care, tetanus can be fatal or cause lasting damage. Consider the story of a gardener who skipped his booster. One small cut led to weeks in intensive care. A simple shot could have prevented it all. Protect yourself. Check your vaccination status